Tom, thank you for agreeing to take part in Féile and have a conversation about all things health and wellbeing. But I think before we start, maybe to give people a sense of who Tom Black is. So if you maybe want to give us a wee idea of, your upbringing, your family life and that, over to you.
Well, George, I'm a dairyman like yourself, and I suppose it started off, the Blacks are originally from Derry, and the Blacks are from Wellington Street, which is a stone's throw from the practice here. My father was a baker with Stevenson's, but he died young. So I was born in Mountjoy Street myself, and when my father died just after I was born, my mother moved us out to Chantala, which was a severe shock to us all, to move out to what we thought was like the country. And I went to St Patrick's Pennyburn School, and from there to St Colum's College. And I suppose if I was going to reference how I became a doctor, it would be the fact that in St Colum's College they taught me science, and they taught me maths, and they taught me well. And I went off to UCD, University College Dublin, spent 6 years down there in the Mater Hospital training, and then came straight back to Altnagelvin. Did my training here in Altnagelvin, always wanted to be a GP, never wanted to be anything else, and always wanted to be back in my community working as a GP. So was very lucky, did my training in Altnagelvin and a bit in Letterkenny and a bit throughout, but mostly in Altnagelvin, and then worked in general practice, and I've been in this practice now for about 30 years. And I have to say, looking after your own people is a pleasure. It really adds benefit to the job you're doing, makes it much more worthwhile. But maybe that's just because dairy people think they're different, isn't it? Yeah.
And Tom, so you're well connected within the community, and you're based here at Abbey Medical. Can you just describe the local people? What does a typical day in the practice look like for you?
To be a doctor's hard work. It's hard work if you're in hospital, it's hard work if you're in general practice, and basically you come in, you work hard, and then you go home. You try and make sure that what you've done in between is worthwhile, that you've put your patients in a better place than they were before they came in to see you. So a typical day in general practice is 200 prescriptions, 35 consultations, 50 hospital letters, 70 or 80 blood results and lab results, dealing with the multidisciplinary team, dealing with the prescription requests. You come in and you just start. And what most GPs now do is the night before they come in, they start and they work on their laptops at home trying to clear prescriptions or blood results, because there just isn't enough time in the day. You get through your day, you do your consultations. More difficult now with COVID. You do your house calls, you try and sort people out, you try and put them in a better place, and then you go home and your wife says, "You look awfully tired today." And I'm like, what do you expect? It's not easy. Or maybe I'm getting old.
So Tom, that's a typical day, probably pre-COVID, but obviously, a lot of that stuff you're still continuing to do. But I mean, with the impact of COVID, how has that changed the way in which you're working? The way in which your staff are working, the way in which your practice is working, and are you going to be working like that, for the foreseeable future? Is there any things that are going to stay, and maybe is there anything that you're going to revert back to that worked pre-COVID?
So George, COVID did change everything. Our big worry was bringing patients in and them exchanging, transmitting infection to each other. And obviously you'd go to the doctor when you're sick, and a lot of people were sick with COVID. So we didn't want the doctors to become a place where you got even sicker than you were. And obviously a lot of vulnerable patients coming in. So what we had to do was start doing the phone triage. Now, phone triage is very difficult. I would much rather see 30 patients face to face than deal with 30 patients on the phone. But it was partly the safety of the staff, partly the safety of the patients, but mostly to try and keep the infection rate down. So we do the phone triage now a lot. Patients, for instance, if they've a rash, we ask them to send us a photograph, and because you don't need to see the patient if they've a good photograph, and people are really good at sending nice photographs in. If you sort, let's say, a urinary tract infection out over the phone, that saves the patient even leaving work, because people are really good at history, and you have to focus down on what the patient's worried about and what they want from the interaction. And then what you do is you bring in that group of people that need seen, the ones that need examined essentially. So We're very fortunate here that we have a multidisciplinary team. So we've got a mental health worker, we've got a physiotherapist, we've got a pharmacist, we've got nurses, and we've got the GPs. So there's lots of choice in terms of what you can offer patients. And a lot of patients prefer to be dealt with over the phone, and some patients prefer to come in. I'd prefer they all come in, but you have to adapt, and you have to make sure that the infections are kept as low as possible, and that this is a place that patients would regard as safe to come and attend. So fewer patients coming in, and hopefully over the next year or so we'll be able to gradually increase the number of patients that can come in.
So Tom, you mentioned COVID there, so obviously that's a hot topic at the minute. We're all engrossed in it. Our lives have been turned upside down for the last 18 months and probably will continue to do so, but I suppose just from your own point of view and probably from mine, and asking on behalf of the people, probably locally and across the Northern Ireland and elsewhere, but are we getting there? Are we winning? Is there still a bit of work to do? How are we? What's your view on it?
COVID looked like it came out of the blue, but to be quite frank, we saw it straight away, and we knew we were in trouble straight away, and we knew this was going to be the once in a century pandemic. The problem was, of course, that it's a cold virus, so with no real protection against this. This was a new mutant strain of a cold virus, and we've had 200 million cases worldwide with 4 million deaths so far from it. So it's been a huge strain on the health service, a huge strain on the community, a huge strain on individuals. We're very well aware that people have worked very hard, they've sacrificed an awful lot to protect themselves, their families and their community. We're well aware that mental health issues are going to be the big issue. We're going to be looking at long COVID over the next 5-10 years. And so far, Derry's had very high rates of infection, but that's typical of a cross-border area. So there've been a lot of mental health issues in the community, and we're worried about long COVID and what effect that'll have on our patients over the next 5 to 10 years. We've also had a real problem in terms of keeping enough staff at the front line. We've had doctors sick, nurses sick. We're prone to the pandemic that everyone else is prone to, but it's always about trying to make sure the doors stay open, that there's enough staff there to provide the prescriptions, the consultations for patients. In terms of where we are now, we've got a vaccine, unbelievable. The pharmaceutical companies have been phenomenal to produce a vaccine so fast and to produce such a safe one, and in billions in terms of quantities. We've had more than 3/4 of people vaccinated now in Northern Ireland. We need probably another 10% to get to the herd immunity that'll be most effective, and we've obviously an issue with young folk at the moment, and I know Féile will be working on that, making sure that we push the vaccinations for younger people. And they need to get the vaccination to protect themselves, protect their family, their colleagues, their friends, their community. Because if we can get that herd immunity, then we can get back to normal. We can get something more like a normal life, more like a normal health service. At the moment, we've hundreds in hospital, dozens in intensive care, and that's sucking up a lot of resource in terms of doctors and nurses that should be applied elsewhere for cancer services, kidney transplants, etc. So we're not there, but definitely going in the right direction, and hopefully next year seeing something nearer to normal. But when you used to look at Japanese or Chinese people and think, why are they wearing masks over the last few years? We now know why, because they've had MERS and SARS predecessors for the COVID-19, and that's where we'll be in the future. We'll be always acting as if there's a bad flu about, but hopefully being able to go on holidays, attend hospitality events, concerts, football matches. We want our lives back, but we'll probably be careful for another few years.
So I suppose, Tom, the million-dollar question is, could we go into another lockdown?
Yeah, there's always a risk of another lockdown. It was Jurgen Klopp that said success leads to complacency, and complacency leads to failure. So we can't become complacent. If you become complacent, this virus will just come back and bite you again. So we need to continue to be careful, continue to work hard with this. I'm a born optimist, and I'm hoping that that's the last of the lockdowns. The one thing that would really knock that back and give us another lockdown would be another mutation, another variant which was more virulent, more lethal for people. We'd have no choice then, we'd have to go into lockdown. The Delta variant is a very successful variant of this virus. In other words, it's really transmissible. It's up there with chickenpox, nearly as transmissible as measles. So it's winning the virus competition of being the most popular virus. And it's not as lethal as some other versions that could be here. So the hope would be, I suppose the simple answer would be, we're going in the right direction. Hopefully there won't be a lockdown, and hopefully there won't be a new variant that is more lethal, and we can just grind our way through this and win this competition against this virus, because this is two organisms competing here, and we're smarter, and we've got pharmaceutical companies, and hopefully we'll win.
Tom, to me that sounds positive. And I suppose, look, given we're 18 months, of a journey travelled with COVID, and you've had time probably, like ourselves and like many others, to reflect. I mean, is there anything, now that you think you could have done, or that we, government, whatever you may think, could have done differently in order to get us to this place a wee bit sooner?
First thing you'd do is you'd realise that this virus is always ahead of you. So we were reacting to events at the beginning and going, what's happening now? And you can't do that with these pandemic viruses. You have to anticipate what's going to happen in 2 or 3 weeks' time and try and stop it happening. So you have to be preemptive and make sure that you're ahead of the virus. So that's the first thing. The second thing is we should have been better prepared in terms of PPE, personal protection equipment. We were very tight for PPE at the beginning, and we were making sure that the doctors in intensive care and in the respiratory wards were getting the best PPE, but that meant that doctors and nurses and other healthcare workers at the front line were in difficult environments, and not just in terms of the PPE, but difficult environment in terms of the physical environment. So have you got a big enough room to see people in? Is it well ventilated? Is there an air conditioning system? What can you do about making sure that the staff are protected as well as the patients? Because you're bringing patients into this area. So I think there's a big piece that has to be worked on in terms of the physical environment of emergency departments, of wards, of outpatients, and making sure that the patients are protected and that the staff are protected. So other than that, I think the extraordinary thing was the speed with which we got the vaccine. I mean, that exceeded all our expectations, because we're still waiting for a vaccine for HIV, and yet we managed to get one for COVID-19 within 12 months. Just extraordinary. So, you can't talk about this without smiling when you talk about the vaccine, and because we could have been in this situation for years to go, and instead we're looking hopefully at getting back to normal. So lots of lessons to be learned. There's going to be a big inquiry. We'll feed into that inquiry. We're already starting that process, and I think this probably should mention as well something around protecting vulnerable patients. I think we probably could have been smarter in that. I'm not sure how, but we certainly needed to protect our old folk in the nursing homes, and that's another lesson to be learned.
So Tom, thank you for that. It's good insight into your experience of COVID. I think now we'll maybe move on to some of the local issues. And obviously your practice is based in the Bog side. Our organisation ourselves is based in Craigan, and obviously we work, collaboratively right across the area. So, just from your own point of view and your own practice point of view, what are the issues, the health issues that are being presented to you on a kind of daily basis? To you, what's the priority? And probably the third question on that would be, what can we do, together, as community organisations, as health and wellbeing projects, to support each other, to make sure that those people living in these areas are supported, and that that they continue on a journey, hopefully, to improved health and wellbeing.
Yeah, I think healthcare in the city has changed remarkably in the 30 plus years that I've been working here. When I started as a young doctor, it was heart attacks every week. It was multiple heart attacks, strokes, bleeding ulcers, meningitis, epiglottitis. All those diseases have pretty much decreased, certainly huge decreases in all those areas, because of medication, because of just been smarter vaccinations, for instance, with epiglottitis and meningitis. And we've worked really hard to reduce the acute illness that people died from. So my job at the beginning was intervening with acute illness. Are you having a heart attack? Have you pneumonia? Is it appendicitis or whatever? All those diseases have reduced, and my job now is nearly one of chronic disease management. So my job is to look after people's blood pressure to prevent heart attacks and strokes, looking after diabetics. With far more diabetics than we used to have. We used to have 30 or 40 here. We now have 300 diabetics here now. And that's a lot. So 4 or 5% of the population with diabetes, whereas it used to be less than 1%. So a completely different job now of looking after patients with chronic diseases. Now we still have the antenatal care, the vaccination program and everything else to prevent health problems. But the future isn't even just the chronic disease man. The future is health promotion, primary and secondary prevention, trying to make sure that patients don't become patients even. You know, if you can avoid the doctor till you're 60, that would be far better than coming in and being treated for illnesses. And of course, the best way to avoid the doctor, and I really mean that, it's better to avoid the doctor than to be attending the doctor. The best way to avoid the doctor is to have a strict diet. You know, don't eat fat. To have a policy where you drink moderately, where you don't smoke, where you keep your weight correct, where you're fairly well educated in terms of health issues. And it's by doing that that you avoid the chronic diseases. So we've sort of not cured, but dealt with most of the acute things that people died from. We're now into the chronic diseases, but we're seeing, you know, if you ask me what's the two biggest problems in the town at the moment, obesity is huge. Obesity is the new smoking. So within the next 5 years, obesity will cause more cancer than smoking, which is inexplicable. And the second big issue is mental health problems. And just the literacy in terms of knowing what is good and bad for you in terms of your health. So if you educate people well, and I don't mean this to be rude or patronizing, I mean, if you're a well-educated person in terms of health issues, and this is what the community groups are doing, and I know you work in this area, and I would say that that's an area which is as important, if not more important, than the National Health Service now, because it's far better to prevent than to treat. A stitch in time saves 9. If you stop somebody becoming obese, if you keep them exercising, if you get them eating a decent diet, then they don't even need the health service. But you deliver that sort of change at local areas, in families, in communities, teaching the youngsters that this is what they need to be doing, signing them up for football teams, getting them out in exercise programs, going to Weight Watchers or whatever it is, having the education in terms of the proper diet and where you would buy those foods. That's what the community groups are doing, and I would see that as the future, and I would see that as the area that the National Health Service should be investing in more and more. In fact, when you think about it, you'd prefer to invest more in health promotion and prevention than initial treatment and, you know, stepping in at the last minute. It's great to save somebody when they're having a heart attack, but it's even better to stop them having a heart attack.
Okay, Tom, so I mean, you mentioned quite a lot there. Yeah, health promotion is key. I mean, a lot of the work that we're about, you know, is, you know, a wraparound service, and health promotion is a key part of that. I mean, I first remember you from a really strong community initiative and partnership we ourselves dating back maybe 14 or 15 years ago, called the GP Exercise Referral Program, and that's still going. So we're still seeing local people presenting with long-term conditions at the surgery and being referred on our Healthy Living Centre and other community organisations for a tailored programme of support. That's something that's a model of good practice, and there's others like that. I mean, you know, we can talk about social prescribing. That has given us a direct link to the Healthy Living Centres, and rather than prescribing, you know, medicines, we're prescribing social activities and support for people in order to make them better. So I mean, just even given those two examples, you know, can you give me your opinion on those? And maybe, is there anything else that, you know, that you have been working on or you are thinking about that the community can tie in with? I know, you know, over recent times, obviously there's the multidisciplinary teams. You know, how do you see those rolling out, you know, beyond today and further? So if you could maybe talk a wee bit about that.
Yeah, the multidisciplinary team, George, has been a great success. And we should mention the social workers. So in this practice for 7,000 patients, we've got 1.5 full-time equivalent social workers, and they're able to work with community services, community groups, and link in and find the patients who are most vulnerable, who would need the health service most, and be able to step in and go, what can we do to help you? Now, it's really important that we have those services outside in the community. It's really important that we invest in those, because that's where you'll get the biggest bang for your buck. That's where you'll prevent illness, which is much more important than treating illness. I know you need GPs and you need hospitals to treat patients who are ill, but if we could get the rate of obesity, of overweight people in the town down, by encouraging them to exercise, by encouraging them to eat the right diet, by making sure that they stop smoking, they moderate their alcohol intake, and all the work that's been done in terms of drug abuse in the town with the multiple agencies, if we can bring that all together and bring that forward as a group with referrals from general practice, identifying patients with greatest need, making sure that the communities, but also the community groups themselves out there, don't need patients to be referred to them. They're in the community. The patients are coming to them. The people, the clients, whatever we call them these days, are coming to them and interacting with them without being told, because people are smart. I mean, dairy people in Northern Ireland, the Irish in general, are a smart race, and they know what's good for them. They have a tendency to do the wrong thing as well. So people need help in terms of education and pointing in the right direction. And I think it's really important to go as young as possible, get it into the skills, get the diet right, get the exercise right, get the boys and girls at their sports, and making sure that everything is coming right through from the youngest age group. So, I mean, everybody dies, everybody will get diseases, but the trick is we all want as long as we can get with a healthy lifestyle. Get to 60 without a chronic disease, get to 70 or 80 if you can, and just expanding that for people, because nobody wants to be a patient, nobody wants to be in front of a doctor, nobody wants to be sick, but you need to do the right things to avoid that, and it's really getting that out in communities where people live as part of an education process. So yeah, the more of that we see, the better, and hopefully with the multidisciplinary teams now, there's better linkages. I mean, my social worker knows all about what's available in the town, whereas I'm busy here writing my 200 prescriptions and seeing my 35 patients today. It's very tough knowing what else is going on. So yeah, I'm positive about the direction of travel here. I still think that the health service, the NHS, spends too much of its budget on fixing problems after they've happened, and too little of its budget on preventing and health promotion.
So Tom, obviously as well, you're the Northern Ireland chair of the British Medical Association, and we hear that being banded around in TV and in radio, but what does that actually mean, and what does that look like? So to your average Joe, what does that entail?
The job as the chair of the BMA's council, it's a difficult job, but before that I was chair of the GP committee. Much more straightforward, I suppose, because I am a GP. My job as chair of council is to look after doctors, hospital doctors, GPs, public health doctors, and medical students. And obviously we've got the second medical school starting in Derry and Magee at the University of Ulster, and we're delighted with that. So another medical school. The job itself, the strapline for the BMA is we look after doctors so they can look after you. So there's 150,000 members UK-wide, 6,000-7,000 in Northern Ireland. So I would represent those members. And in fact, I would represent negotiating terms and conditions for all those doctors and medical students. So it's a very busy job. I spend half my time in the practice and spend the other half doing that. And you're trying to make sure that bad things don't happen in the health service, that if something is going to go wrong, that you step in, you have a word with the civil servants or with the minister, and you say, this is this is going in the wrong direction. Let's move this around. And obviously, it's a bit like medicine to some extent. You're trying to stop bad things happening. You're trying to prevent illness in the health service. Then sometimes you have to fix problems when they arise, and COVID has been a huge issue. And the healthcare workers, doctors that I represent, have been really brilliant during COVID. Worked very fast, adapted, were flexible, worked extra hours, got stuck in there straight away, moved the whole service around so that they could adapt and provide the service that was needed. And we're proud of all the healthcare workers, from the porters to the ward clerks. Everybody went in, did their bit, put themselves in harm's way, put themselves at risk, worked hard, and they're all worn out now. Of course, 18 months later, they're just completely fed up, worn out. Some would have burnout and some PTSD, but most of them are just fed up and wanted to go away. We've had enough of this particular pandemic, would like it to go.
I would totally agree with that, Tom. I think we're indebted to the staff right across the health service, but not only that, from my own point of view, all the staff and the volunteers that have been involved in the community sector, over the last 18 months. I mean, the reaction and the assistance and the support that they've provided the local people has been tremendous, and it's something that I don't think that people will ever forget. They'll always talk about it. But bearing that in mind, I suppose, given that the last 18 months has been challenging for everybody, what about yourself? What do you do to relax? How do you de-stress? What type of things, give you that sense of, right, I'm away from my work and I feel as if I'm in a different place and it's good for me, So what do you do to promote, your own positive mental well-being in that?
I think you're right, George. I think everybody has worked really hard and sacrificed throughout. We see our patients struggling. Voluntary workers, community workers, healthcare workers of all sorts have really gone above and beyond, and they have worn themselves out because it hasn't been the same opportunities to de-stress in terms of social events. It hasn't been the same opportunities to travel abroad and just disconnect and find some rest and peace. What I do is I walk every day. I try and get about 10,000 steps in every day. I bought a bicycle. I try and get out on the bicycle because for some reason it makes me feel like I'm 10 years old. Bicycles are just brilliant at putting a smile on your face. And a garden. I have a garden which isn't in great state at the moment because I've been working too much, but I try and garden and make sure that my flowers and my fruit are being reasonably well looked after. But it is very important to watch yourself, to listen to your body, and to watch your interaction with other people, that you're not too sharp with people, that you're trying to maintain civility and kindness with other people, because you have a tendency when you're being too hard on yourself to then be too hard on those around you, and you just need to listen to the signals and try and make sure that your diet and your exercise and your sleep and your civility is maintained. But it's just been so difficult in the last 18 months, but everybody's doing their best.
Tom, thanks very much. I feel as if I could probably talk to you all day. I know that's been quite a long session, but there's some really, really important stuff in that. And I'm sure, local people will really appreciate as part of Féile, getting an insight into your thoughts and your feelings and your experiences over the last 18 months. And I suppose, on behalf of myself, thanks very much. On behalf of Féile, thank you. And I would just probably like to maybe give you the opportunity maybe for some closing remarks, trying to keep it positive for the local people. If you want to just finish off with a short message, that would be great.
Thanks, George. And I think we should refer back to the first principles of health service, which is it's free, it's universal, it's there for your needs. And I think in Northern Ireland, we're very well aware that this is a community resource. This is a resource for us all to share. And obviously, the healthier we keep ourselves and the less we use the health service, the more is available for your granny or your niece or your grandchild that's unwell. And we all love the health service. We love it because, you probably know this, and a lot of the listeners will know this, but when you go to other countries, they really worry about debt associated with health, and that's something we don't have here. We don't worry about going into debt or going bankrupt because we don't have a health service that we can't afford. And I've seen patients come back from America halfway through their chemotherapy to get the rest here. And that's just something we wouldn't even consider. So a free health service that's universal and that's based on need is just such a wonderful thing. Going forward, I think we're going to hopefully get out the other side of this pandemic. We're hopefully going to see something more like normal. We all know what normal looks like. We want to get it to as close to that normal as we can. We all know how to get there, which is get your vaccine, look after yourself, keep your distance, wear your mask, etc. I think one of the big things that's really put a smile on my face is the second medical skill, because we now have a medical skill in the Northwest. UU has done a brilliant job. Professor Dubras, the Dean of the Medical Schools, done an amazing job. And that really enthuses me because we're not just got medical students in the Northwest, but we're going to have future doctors who we trained here in the Northwest, and we're going to train them as best we can in general practice so that Derry, Tyrone, Fermanagh, Antrim, Armagh and Down all have a good run at getting doctors for the future, because nurses are really important, healthcare workers are really important, volunteers and community workers are really important, but there is something about doctors that you do unfortunately need to have them in your health service. So that's underpinning it for me. So in general, we're much better at healthcare than we used to be, but every time you improve, you want to improve more. It's a never-ending job, but it's a great pleasure to look after the people in this town, in this area. I have to say I've enjoyed my career, and I would encourage any young person that wanted to go on into the medical school to go in that direction, helping people, making a difference, doing something that's worthwhile and challenging. That's the key to life, isn't it? Thank you.
Thank you.